welcome back to the Love is Healing podcast, where we talk about complex trauma, integrated mental health, functional medicine, frequency medicine, sex, and other addictions. Today we have our guest, Trisha Taylor, is a mental health therapist who focuses on emotion-focused couples work, trained in NET and EMDR. She works out of Tulsa, Oklahoma. Welcome, Trisha. Thank you for joining us here today.
Thank you. Glad to be here.
Thank you. Thank you. Since we're going to be talking about your couple's work primarily, let's talk a little bit about EMDR and NET. Can you tell us about what they are, what differences you see in practice, how you like to work with them?
Yeah. EMDR is predominantly known as a trauma-focused therapy for healing from trauma to reprocess. It works with bilateral movement to help the brain go back and process things that were left unfinished, kind of so to say. And NET has some similarities, like it can also process trauma, but it can also be specified to our feelings, to our beliefs and cognitions, which EMDR uses that as a piece. And so for me, I see NET as like a gentler way to go in and do trauma focus because the body itself titrates where it's ready, willing, and able to go. Whereas EMDR can feel kind of like you're shoved into it. And depending on how that process goes, that can be helpful or it can be harmful. A lot of times I like to use NET as a precursor to prep and then determine if we still need EMDR or if it's no longer necessary.
Thank you for that. I agree with you. I have used both EMDR and NET as well. And what I tend to tell clients is EMDR can be a little bit harsher. In my experience, you tend to have more flashbacks or other symptoms like that. Things can like really come up and become really intense in between sessions, which can be really tricky. For neuro-emotional techniques, quick and simple, we cut off a layer. As you mentioned, it does go wherever the body goes. If your body isn't ready for a level of processing or clearing, then it's not going to show up on a muscle test, which that's a built-in safety, which I appreciate,
Mhm.
right?
Yeah.
And NET can be used for anything, really. Please chime in. It can be used for physical pain, it can be used for emotional discomfort, it can be used to help emotionally, physiologically clear trauma out of the body.
Right.
Because it's not like talk therapy, right? You can use it with talk therapy,
Right, right.
but it's not the same thing. And then I just recently saw it used for addictions. I mean, there's so many different modalities, so many different things you could do, right?
Yeah. I love the versatility of it. Clients like readiness and positioning is different. And so sometimes they know like, hey, I want to be able to do this thing and I can't. And so we can use words to get there, right? Like, I'm okay losing weight. I'm okay, right? Whatever that piece is that they're like, I really want it. And I tell my clients a lot, sometimes we know things here, but here it doesn't resonate. And that's usually a good clue that there's like an incongruence there. And that means that some self-sabotage is likely to be happening. I think NET can help us, number one, decrease that self-sabotage by finding where that belief kind of got off track and allowing the body to say, okay, we don't have to like loop these thoughts and ideas together that were previously connected together.
Absolutely. And then there's a component of it too where you can use some sprays, which is homeopathy, to help clear the meridians even more,
Mm.
which in my experience helps to deepen the clearing of the emotions and the patterns and the pains and things like that. You are doing therapy as a second career. What drew you to do this type of work that is therapy?
So actually, I was a patient of a chiropractor who did NET. And that was, oh gosh, 20 something years ago. And so I found it to be so amazing and so helpful in my own life and in the lives of my children, that I really wanted to be able to learn the technique. That wasn't something in my ability to do because I was a stay-at-home mom. I wasn't, I wasn't in a mental health field or in a health science field or any of those things. As my kids began to move to emptying the nest, and looking at what I wanted to do, that thought came to me and I was like, okay, what career field would I need to be in to do NET? Science was not my favorite, so chiropractic was not in the cards. Mental health was. And so that's what kind of got me going in that direction, was really the desire to do NET. And actually, then, as I get through school, in my area, there aren't other therapists that do NET, only a couple of a chiropractor and an acupuncturist. Going through school, heard more about EMDR, which is why I ended up getting trained in EMDR first. And then I had a client come in and was talking about this weird thing, NET, and I was like, oh my gosh. Then that like kind of relit the fire and got me actually into training for NET.
That's wonderful. You're really wanting to get to the root cause and really help people.
Yeah, yeah. In school, we read a book, The Body Keeps the Score. And it really, for me, solidified so much about how that mind-body connection works. And then I went on to read some other books, When the Body Says No by Gabor Mate, and it just talks about how disease gets stored in our body a lot through emotion and experiences. And so, yeah, that's really a passion of mine.
Very good. Thank you for that. You work with individuals and you work with couples. What really drives you, motivates you to work with couples?
Because I look at all of us through a family systems lens. The more of the system that you're able to involve in change, the deeper the change seems to impact. One person does change the system. It's just a slower movement process, right? And sometimes it's met with more resistance, sometimes it's met with less resistance. But when I have both people in the room, the system is likely to move quicker, deeper. Also, getting to see the rewards of those behavior shifts and how they affect each person. Super passionate about that. And it's super rewarding to see when something clicks and you see this connection happen that wasn't there before.
I love that too, because you're not only seeing the change in the individuals, also the couples, and then ultimately that's going to impact the family system. And if there's any children, also that, and generations really to
Yeah.
come.
Yeah.
Whenever clients want to, you also incorporate faith into that. Can you speak a little bit about why you do that, what that is, what the benefits are of people incorporating their faith into their therapy?
Yeah. People who have a spiritual viewpoint, that's typically a really big part of their life. And so if we exclude that from the therapy room, you're excluding a really big part of them. While it's never something that I force or push on somebody, even though I, have a strong faith, when they're open to it and when that is a part of their life, I definitely want to bring that in, allow it to have space, right? Because it takes up a lot of space in their life. Allowing it to have space in my room when we're talking about these important things of their life is integrating the wholeness of them into the therapy process.
Absolutely. And to me, I see that as being able to deepen the work, right?
Mm.
And help people make deeper meaning out of their lives, out of their suffering, out of their healing.
Right.
As we talk a little bit more about couples work, can you also explain to us what emotion focused approach is?
Yeah. So emotion focused therapy looks at the root causes that are behind the tension in the relationship. We have a fight about something. And I don't know if you're like me and you can remember that time when like I've had a fight and I walk away and I really don't even remember what the fight was about, but I feel like crud. And so I explained to my couples that's because the fight wasn't really about the thing you thought you were fighting about. It was about a need underneath that most of the time neither party even fully realized that was there. We're fighting so hard for something and we're not even hitting what that target actually is. With EFT, it helps a couple look at what their cycle is like, that repetitive pattern. You look at every fight you've had, and there's a pattern that tends to sit in those fights. And so we look at that and we look at the behavior that comes within the fight. what's underneath it and what need is it fighting to be seen. I share a story from my own personal life with a lot of my clients. I have a system of how I use our towels in our bathroom. And so one weekend I wash the laundry and I come home and my husband has pulled the wrong towel, from the wrong side of the system. So it's kind of like, think the grocery store, they stock forward, right? So I start going off on him. And all of a sudden I see myself in the mirror and I think, this is ridiculous. What is going on? And so I pause and I ask myself, like, what does this mean to me? My first thought is, I put a lot of time and energy into this system. And so if he's just pulling any towel, what does that mean? Well, it means that he doesn't care about my time and energy. Okay, if that's true, what would that mean? Oh, well, that would mean he didn't care about me. Ooh, if that's true, what would that mean? That would mean I'm not loved by the person I really want to love me. So now I understand my need to fight. Really, internally, what I'm fighting for is show me you love me. So those are the kinds of things that we see in a cycle with couples all the time, where the fight looks like it's about the towel, and really it's about show me I'm loved. And if nobody notices that message, then hurts go on and continue, and they go into the next fight, and that giant gets bigger and bigger and bigger until that fight creates so much disconnection that we feel like we're living kind of in separate worlds. EFT helps couples slow down and look at what's that thing underneath.
That's a wonderful description. It sounds like you're starting somewhere and then you peel back the layers over time. I can see how that would get to the roots of the resentments, as you're saying, because that makes or breaks people, for
Yeah.
one. And then secondly, it involves a lot of vulnerability to actually talk about the root. Because if we're talking on, at the surface level of like, well, you pulled the towels and this happened or whatever, and you need to put it back. Yes, that is a really behavior-based thing. It is also aggressive. And if you pause in the moment, and then if you're able to be more vulnerable and say, hey, listen, I thought about it. And you pulled the towel. And really what happened was I felt really unseen and sad and unloved. So that's one layer. And then like taking ownership. I know that wasn't your intention, or maybe it was your intention, but here's what I'm needing in this situation. So being able to acknowledge things and being able to take that ownership and then being able to ask for our needs.
Mm,
So that's
yeah, and in my case, when I realized what the need was underneath, I turned to my husband and I apologized, right? Because that was taking ownership. I kind of went off on him. So I can't take ownership of his piece. I can take ownership of my piece, right? And then I told him, hey, my brain did this crazy thing, and what I really need is a hug because that tells my body that you love me. And then my nervous system was able to settle down. You're right. It's completely vulnerable to go to that place. Number one, to even explore it for ourselves. Number two, to share it with that significant other. But when that vulnerability is seen and met, then you as the individual feel seen and met, which then makes it feel like you matter to that person who's caring to meet you there.
absolutely. And I'm going to throw in a trigger warning here for any childhood trauma. And if you want to skip a minute or so, please go for it. Or take care of yourself and pause it, etc. I hear what you're saying, Trisha, and for people who experience watching any domestic violence or anything like that, being verbally abused themselves, or even in past relationships, it could be particularly tricky because the fight response comes out.
Hmm.
And for some people, the flight response comes out. So the fight response is like, I just want to be aggressive and I want to defend myself. I think the defensiveness, that's tricky to catch unless you have an eye to be able to catch it for yourself or for clients. And then the fleeing also, it just looks like a way, you know what, I don't want to talk about it. It's not that big of a deal. Let's just sweep it under the rug.
Hmm.
And that's fine. And it can also point to deeper dynamics that happen in one's upbringing, huh?
Right. Yes, for sure. And obviously, as a therapist, right, the people I'm sitting in the room with, some of the tools that I'm utilizing in certain circumstances, relationship situations, it wouldn't be safe to like pause things and evaluate like that, right? There are dynamics where that's definitely not ideal, bringing out that vulnerable side. Then there are other dynamics, in my example. I knew that an hour before that, my husband had gone in the kitchen and cooked me food. And when I was still hungry, he went back and cooked me more, right? I have a lot of touch points that actually counter and tell me he does love me. If I were in an abusive situation and there were other counterpoints, that would not be healthy for me to pause and explore all my things when there needs to be some defensiveness on his end could be triggered, you're right, by things that he's experienced before. And now here I'm like coming at him. My ability to be vulnerable and apologize, take ownership for my piece of it, can allow that defensiveness to come down a little bit.
Absolutely. And the science behind that in general is because in this specific situation and in general, whenever we have a stressor, the stressor is, hey, something isn't going according to plan. Your initial response was the fight response.
Mm-hmm.
And then as you stepped back, then you were able to regulate your body and create safety within your body. Invite him to have a safe, neutral conversation with you.
Exactly. Yeah.
Yeah. In general, in society, that's something that we could all benefit from. The more we're able to practice that, not just at home, but also with our children, also in the workplace, also out and about. People are imperfect, people make mistakes, like people get your order wrong. Yes, it happens. We do have choices in those moments, right? We can react and we can berate people, we can yell at them, we can choose to like pause. And I like how you really delineated that. Like, what's going on for me? What does that mean? What does that mean? What does that mean? What does that mean? Get to the root. What is my actual need? And then be able to take action there. Takes work, takes practice, also completely life-changing. Yeah.
Yeah, and it takes being aware. Like a lot of my clients initially aren't even aware that there's emotion and unmet needs that I call it the story they hear, right? The story I heard was that I wasn't loved. Now, in my case, that was not truth, but that was the story my body heard and took in.
Yeah. Then in being validated, there's that safety and there's that connection and
Mm,
that softening. So that's awesome.
yeah.
Oh, thank you for that.
Hmm.
What words do you have for the audience listening in today about ways in which they can cultivate more connection in their intimate relationships?
Cultivating connection really happens when we open up that vulnerable space. That means being able to look in ourself and gain understanding, because without that, I can't be vulnerable if I don't even know the piece that's there. A lot of times I feel like it starts with recognizing something is happening in your body. If you're not attuned to or used to understanding what your emotions are telling you, because sometimes they're telling you truth and sometimes they're telling you an old story, right? And so learning to hear that, hey, my body is feeling this way. There's a message somewhere in that, right? Recognizing, what do I feel? Oh, I feel tightness in my chest. Okay, what does tightness in my chest mean? Right? Maybe it means I'm nervous. Maybe it means I'm upset. Then I get to explore that and find out what's the story behind that about for me or about me. Back to my towel story analogy. Okay, what does this mean? What does this mean? Okay, what does that mean about me? Right? Is what I eventually got to, because that's where I find where the story is or my unmet need is. A lot of times it's starting with noticing the body. In my towel story, I saw myself, but I also noticed my shoulders were like this, right? So that tension in my body first told me, obviously, I'm trying to fight for something, right? But also it's like this defense of like getting smaller because something doesn't feel like it's getting met. Asking ourselves, like, what's happening in our body? What's the story that goes with that? Well, it means that she this or that he that. Okay, if that's true about him or her, what does that mean? Go a couple layers in. And if that's true, what does that mean about you or for you? Sometimes the story that we hear is it means that I'm failing. So that means something about me. Sometimes the story we hear is I'm not enough. Of course, our body wants to fight or get away from that. Take a break. And I see the I'm failing belief or story. Those are the ones typically that shut down or want to go away. Or they want to explain the intent in the behavior because their thought process is, if you can hear my intent, then you'll know I care, which will mean I didn't fail. That creates disconnection because the way that lands for the other person as you're explaining is like their feelings don't matter and you're shoving them further and further away. Connection is saying, wow, when you said this, when I heard this, what I felt was, oh, I'm giving you my experience. Or if you brought me something, connection looks like, wow, I could see how it could feel that way for you. Asking some questions, I like to say get curious. Get curious about your spouse's perspective, right? It's not the same as yours, but if we're both looking at this, we're looking at the exact same object. And if I start telling you about that coconut in the middle and the vitamin E drop on the other side, you're like, what on earth? Because even though we're in the same thing, we are not seeing the same viewpoint. And this is every interaction in life, right? Because I bring the lens of my life experiences into what I'm seeing happen right now. And if I have a lens because of past experiences that told me love wasn't always present, then my body is scanning for that in the circumstances that I go into because I'm always looking for it to be there, but I'm also hypersensitive if it seems like it's not there. Connection looks like me being able to recognize that that's showing up, offer that to my spouse, say, wow, I didn't see it that way. I could understand how if I was in your shoes, it would feel that way.
That empathy and that validation.
Mm.
I recently went to a seminar and the instructor was saying that relationships are a place where you go to give, not to get. And then,
Mm.
I mean, that was a good reminder.
Yeah. I heard on a podcast somewhere, and it has stuck with me, and I have said it to my clients over and over again. Connection is fighting to understand, conflict is fighting to be understood. Connection causes me to get curious about your perspective, to seek to understand the point of view that you have, even though it's not the same as mine. And with your spouse, because you matter, I really want to understand your point of view so that I understand when you hurt and I understand when you're afraid and I understand when you're sad, even if that's not how I see it or that wasn't my intent.
Definitely. Thank you for that. I just see so many benefits of creating that connection with your spouse or with your partner, or if you are in a polyamorous relationship with your partners. Ideally, that is your safe haven. And if you have that safety there, over time, you continue to borrow from that. And that
Mm.
safety lives in your body. And if you have safety that lives in your body, then you're able to interface with the world in a way where if this is what's inside your heart, this kindness and this support and this empathy, then you're able to give that more out in the
Mm.
world. You're able to function better. You have more resiliency.
When you look at, attachment studies and you look at things through an attachment lens, right? That is initially formed in your first like 2 years of life, but it changes throughout your life. And so, say I'm in a relationship with my significant other and connection and repair are not a part of our relationship. I can go from being a securely attached individual to being anxiously attached or being dismissive avoidant based on those patterns of interactions. Connection is so important for helping to keep that secure attachment or create if it wasn't there before.
Exactly. And for the audience, because we haven't covered attachment styles yet, what are attachment styles and what are the differences? Why do they matter?
Attachment styles are how we connect with individuals and how we also see ourselves in the scope of that, and also how we handle or deal with emotional tension. You have securely attached, which is the healthiest attachment style, a dismissive avoidant, which is someone who it's a push-pull dynamic. When you're walking away, they want it. And then when you're coming back, the engagement feels too scary, so they pull back. Anxious attachment, which has even more of a push-pull dynamic. Like, I need you, I need you, I need you. When you come close, it feels good and I feel secure enough. But if you're at all distant, then I'm kind of like in panic mode. And it's like whatever it takes to get you to come back. There is also anxious avoidant, Submissive avoidant more has a hard time with emotions and connection in general. Anxious avoidant is kind of, I guess that would be more that one that's the push-pull in the avoidant style.
I look at it like secure is I know who I am. I know who I am in the world, regardless of what's happening. I can advocate for my needs. I'm good. I can talk to other people. I can interface. I know how to set boundaries. I know how to identify what's healthy, what's not healthy, and I can respond accordingly. Anxious is more I'm seeking connection. Avoidant is more I want connection, but it's too overwhelming, so I'm gonna move away, which those two tend to pair one with one another, which is
Yes,
tricky.
yes.
So tricky. And then the disorganized attachment is somewhere in between. Hey, I love you. This is so cool. Let's come close. Just kidding. This is too close for me. But wait, but come back. No, but I just there's that internal conflict. Thank you for that, Trisha. It's helpful to know our attachment styles because we know what can trigger us and we know how to respond in relationships. And again, it is tricky. A lot of avoidants tend to find anxious people. So then tend to need extra support because
Mm,
it can be really hard for both of them. And like the anxious person would need to know, hey, people need space and it is hard and let's figure out how to take care of you while your partner needs space. And then the avoidant person would need to know, hey, you need a lot of space. Also, you did choose to commit to this relationship. And if you're going to be in it, then let's figure out how to take care of you as you lean into connection. Let's help you figure out how to safely connect
mhm.
with yourself and
Yeah.
things like that. So it's a dance.
You're right. The anxious and the avoidant do most frequently tend to be paired together, and they both desire to do work. They can really help each other create more secure attachment and balance. If both partners don't desire, then it can be a very difficult dynamic.
Yes. And to that point, what recommendations or informational tidbits do you have for the audience of like, hey, I would love to do couples therapy. Actually, that would be so awesome, but my spouse, partner, fiance doesn't want to.
Family systems, one person can create change in the system. It's likely to be slower, and that spouse may come alongside eventually, and they may not, and you may have to just learn tools that help you become more securely attached or more aware of your triggers so that you can create healthy boundaries and healthy interactions from your side. Yes, obviously, we love it if both people can come and both people have willingness to engage, but one person still can change the dynamic. If you think about it like cogs that work together, right? If one shifts, the others by default have to do some type of shifting, right? It doesn't always mean it's positive shifting. And that can be hard because those wheels can feel like they're grinding and that can be tough. But it is possible, and it is possible to become more congruent with yourself and boundaried in a way that makes you more healthy.
Absolutely. Thank you. Can you tell us a bit about your NET work with couples?
Yeah, I love utilizing NET with couples and individuals. Couples, a lot of times where I found it is dynamics either that come out in between them that we can treat together. And what I love is because NET can look back at original events where these feelings were present. A lot of times spouses can see, oh my gosh, this was something from when they were 5. And so when it shows up today, it's like little 5-year-old them is here dealing with it, right? And so it's not just about me and our interaction. Like there's something internal for them that's been hard about that, which can bring a lot of compassion and it can bring a lot of understanding. I've also utilized it when we've done repair work after an affair. Intimacy is one of those pieces that can be hard after there's been an affair present. Sometimes we get to a place in the healing process where the spouse who was hurt wants to have more intimacy, wants to go back to that place or recreate that place, but they're struggling because there's like this internal block that kind of shuts them down. So I've been able to use NET sometimes to help break down that block, finding again what's underneath. And a lot of times, amazingly, it's stuff even from earlier than prior to the marriage, right? That like is connected, that the brain is saying, hey, these things went together and this is the same. Being able to use NET and see some of those walls come down and see it create space for the couples to be able to gain more ground in connecting. has been really rewarding, but also seeing ways that things from their childhood or things from their, past prior to this specific event have just kind of blocked in the process of processing, and created roadblocks. And to see those get removed to allow them choices has been really rewarding.
Thank you. And I think to reference back what we were saying earlier, it's like you can use CBT all day and talk about it and rationalize. And at the same time, it sounds like with the NET, you really see the body recognizing and really internalizing the healing that happens.
Yeah, yeah. Well, and if you think about, if you have an event happen that's really sad and you're sobbing and all of a sudden you have to like kind of suck that up. Not because like someone said, "Hey, suck it up," but you have to like you freeze that process, right? So NET kind of allows that process to like finish out so it doesn't have to continue taking up space there.
Absolutely. There's an intervention in NET called a space clearing. What do you know about that? What can you share with the audience about space clearing in NET?
Yeah, a space clearing is amazing, because it looks at like as couples come closer and or go further apart, what is triggered in their body, right? What emotions come up? What past experiences are linked to that? And so walking through that process and doing NET with each partner helps clear that stuff out so that those barriers do not stay there. And it can, again, it can lead to that like deeper connection. Sometimes you see a lot when there's coming together. Other times there's hardly any, but it's when they go apart, which is like, I don't want to be away from this person, right? Which sounds really endearing, but that can also be really detrimental if it stops you from being able to do the things you need, and then it creates this like cling, right? Which then can become unhealthy.
Yeah, definitely. I've used it about 3 times, all of them on friends, and I've seen positive results. They do give us a caveat when they teach us that intervention, and they say that it can either bring you closer than you've ever been with your partner, spouse, or it can pull you away further, or like cause a breakup, that kind of thing. Because it'll give a person clarity. Because to your point, there are a lot of rifts that happen in relationships. And so, like, in clearing that a little bit with the space clearing, a person has a knowing of like, okay, yeah, cool, good, we're good, we cleared this up, it feels good, like, yay, the air is clear, we can continue. Or, oh, wow, actually, I mean, actually, I haven't seen it on the other side, but I suppose it's something like, oh, yeah, actually, I don't want this after all, and I'm just here out of habit, kind of thing, would be my guess.
Yeah, but it still allows for you to make a healthier choice for the version of you that you are truly are, right? Because, that's what I tell couples when they come in for counseling is that if your goal that you're telling me is for you guys to stay together and work it out, that's what we're going to work towards. And if the goal is to find the healthiest space, that may be together and that may not be together. And I'm not determining that, but the goal is to bring you clarity so that you can determine that.
Exactly. And it can be really hard, and at the same time, it's worth it, right?
Hmm. Yeah.
Yeah.
I say a lot that sometimes the right decision isn't the easiest decision, right? And sometimes there's pain even with the right decision. A like happy example is when you have a child, right? Like for me, I wanted to be a mom. Having a child was amazing, and it was freaking hard, right? Like losing the sleep, having emergencies that happen with them, right? Like, and so it was the right decision for me to have a child, but that didn't mean everything went smooth and was great. And there were definitely moments where it was like, maybe this wasn't the road I wanted, right? But those were moments. That wasn't the overall journey.
Definitely. Some flags in general of, hey, maybe it's time to start looking at considering being in couples therapy or couples counseling would be when there's a betrayal within the relationship. Yes, in the form of infidelity or any other one. So I work as a CSAT, so we also see financial betrayal. Could also be just addictions in general that are popping up or addiction-like behaviors, compulsive behaviors. I think that could be particularly helpful because it's big. And so we want to be able to work through things. To your point, Trisha, like we want to be able to work through things ideally so that they don't get stuck in the body and so that they resolve and so they're not lingering and they're not ghosts that are here and so they don't impact the communication and cloud it up, right? And the resentments grow and things like that.
Mhm.
When a parent dies for one or both partners, when a child is born, I think that's really helpful, especially if it's your first one, because what happens is the nervous system gets activated, and whatever traumas happen, whatever happened at the time of your birth, that's going to get reactivated as well, right? So you can see how, like, if there's like adoption that happened and one of the partners, this would be particularly tricky, or they had neglect that they can acknowledge and see or abuse. Could be really tricky. And also, not only that, there are a lot of hormonal changes that happen in both
Mhm.
partners, right?
Right.
So there's that piece. Also, when there's a death of a child,
Mhm.
oftentimes couples tend to get divorced when there's a death of a child. So it's important to have extra support to make it through, right? Miscarriages, infertility as well. Like these are really big things. And I know that there isn't a lot of space to talk about it necessarily within just the general community. So it's important to make space for that.
Mhm.
Minimum to help each other have empathy for one another, to help one another see, hey, here's where I'm at, how can we move through this, that type of thing. And then also communication issues. Can you speak about what that's like being a couples therapist, seeing communication issues come up a lot?
Yeah, I would say probably 95% of my clients, that's kind of what they voice when they come in, is that there's communication issues, which really for me, it boils down to, right, that need that's underneath. They don't have tools of how to recognize that. And so therefore they're not really talking about the thing that they're talking about a lot of times. And so usually both one or both of them is kind of saying things like, I don't feel seen, I don't feel heard, I don't feel like I have a voice. If that's one, then the other one's usually saying things like, I don't feel respected, I don't feel valued. Right. And so they think that it's because of communication, and that's an element of it, but it's really communicating about the right things, those underlying needs and desires that help us feel seen and heard and validated and connected.
Absolutely. And then slowing down again would be that medicine, building that safety, everything we've been talking about in this episode within the
Yeah.
nervous system, within the relationship, those could be really helpful.
Yeah.
What final thoughts do you have for the audience today in regard to ways that people can polish their relationships?
Mm. Thinking about what's underneath, right? If you're feeling a way when you're having communication with your spouse, like kind of do a pause and search, what's this feeling and what is it telling me, right? Feelings are energy and motion. And so they're looking to be seen and heard. And when they aren't, they get louder. That's when you see arguments happen and explosive things, right? Is because those feelings are asking to be seen and heard. And even if you're the one that sees them and hears them, that gives them a voice.
Thank you for that, Trisha.
Mhm.
I really appreciate you being on here today.
Thank you
Eh,
so much for your time and for your listeners. I appreciate it.
Of course, you're so welcome. It's exciting stuff and very important work also.
Yeah.
Yes. For anybody wanting to find, work with Trisha Taylor, you can find her at Connect and Restore in Tulsa, Oklahoma. Their website is connect and spelled out restore.com. We'll see you next time. Bye.